My name is Lillian, and I am a student at the School of Public Health. And my MPH project was based around PrEP. And my co-presenter is Dr. Edith Naku, who is a senior faculty at the School of Public Health and has been part of the group that has been doing PrEP research in discordant couples in Uganda, in the region. So I'm sure most of us received the article. I'll just talk about a bit of how the presentation is going to go. So I'm going to give an overview about implementation science research and how this protocol fits into implementation science. Just to give an overview of how implementation science protocols are appraised, and then Dr. Edith, who is more based on the subject matter, will come in and talk about the details of the paper. So, implementation science seems to be a relatively new field. Some of us wonder, what really is it? Is it clinical medicine? Is it public health? What are these people doing? What is the science component in implementation science? So I just want us to take a step back of what we are used to. In appraising articles, we are used to appraising clinical trials, observational studies, and also trials based on diagnostics. And we have like checklists that are available that we are used to using. So more recently, there's what we call the INSPECT checklist. This INSPECT checklist has recently been published around May this year. And it's really trying to standardize an approach of how to critically appraise implementation science proposals. And so as part of my overview, I'll just roughly apply it to the paper today, and then Dr. Edith will give the details later. So one of the components of this instrument is to be able to clearly identify what the care gap is. And in this paper, we see that the care gap was clearly defined, and this was really being able to transition PrEP delivery to scale in the setting that they were interested in, that was care. And they used local data to actually support that gap. So you go ahead further to ask yourself, is there evidence-based treatment to be implemented in this implementation science proposal? And there's clearly evidence of that they cited in the paper, and that is the mode of delivering PrEP as bridge to antiretroviral therapy. So Dr. Edith will go further into that intervention, but we see in the paper that they clearly provided references for clinical trials done in the same setting in Kenya, both the efficacy and the effectiveness trials, and now they want to transition that to scale. And the other key component about implementation science proposals is to be able to be based on an implementation science specific theoretical framework or conceptual models. And we see that evidently in the paper today, that is the READINESS and the CFIR models, which will also be discussed in detail. I'll only give an example of the objectives. Ideally, the whole concept of the paper, right from the study questions, the hypothesis, the objectives, the outcome measures, there should be evidence that this is based on these implementation science specific models. There are other models, but today we shall just base on what the paper gave us, and that is the REAIM and the CFIR framework. So I'll just give a brief example of the objectives. So the first, R stands for reach. In simple terms, who are the people going to be reached by this intervention? So we can see from their specific objective 1 was to facilitate delivery of PrEP integrated into ART care for the discordant couples in public HIV care centers. So we can clearly see what the reach is in that objective. So E stands for effectiveness in the REAIM model. And you can see there is an effectiveness component in their objectives, and even as they go on to measure the outcomes. So they had an objective on determining efficiency, cost, and cost effectiveness, which is a key component of implementation science. So cost effectiveness of the model they were testing, that is integrated PrEP and ART, when delivered in public health clinics. Now this is key in a real world kind of setting as opposed to the clinical trial. Then A is for adoption, and they did have an objective on that as well. Assess facilitators and barriers to implementation of PrEP, and also optimize PrEP adherence in public health with limited measurement capacity. So barriers and facilitators come in here. And then implementation, that is an obvious one from objective 1. And then M is for maintenance. And you can see in their last objective, they had an objective on maintenance where they want to develop operational tools that will actually expand and support delivery of PrEP at scale and secure buy-in from relevant stakeholders to ensure that what they are doing continues to scale at national level even after the implementation. So that was as far as theoretical models go. So the other component in this instrument is to look for evidence of stakeholder priorities and engagement. Remember, you're sort of coming into the real world, and there are all these stakeholders. So the stakeholders, they should be identifiable there should be evidence that the stakeholders were actually comprehensively described. I don't know what you think, but I thought it was a bit of limited description on this. It was mainly based on the government people and the STI and other key players I feel were left out, mainly the people who are actually going to use this intervention. And then, is there evidence of a stakeholder analysis plan for collecting information on stakeholders' interests and priorities described? Yes, they mentioned a bit on the fact that they will hold regular meetings with the government officials and the implementing partners. So maybe yes. And then also you ask yourself, were stakeholders involved in the conceptual design of the project? What do we think? I think they were, but it was a bit limited. They were only involved in selecting a few of the clinic. Maybe they had their reasons for that. Dr. Edith will get into the details for that. But then the other question is that explicit evidence of collaboration between the stakeholders and the applicant. So this instrument is quite rigorous, and it calls for having that explicit evidence of that in form of like a memorandum of understanding, you know, that there is collaboration between the stakeholders and the person who is implementing the intervention. This is mainly to foster sustainability of the project afterwards. Another thing to assess is the readiness and setting to adopt a new program. The applicant of this proposal should be able to do that evaluation well before coming up with this proposal. So I didn't really see any preliminary data that was sort of assessing readiness. Feel free to disagree with me if that was there. And so I thought that this was lacking. So the other thing is that you need to look out for the implementation strategy or process. This was beautifully described, and the details later. And then of course this is a scientific, it's scientific research, even if it is, you know, implementation in the real world. So that the measurement and analysis section should also be prioritized. So of course the described outcomes should be implementation science related, and obviously if they are based on the theoretical models that we talked about earlier, they will definitely be IS related. And yes, the outcome measures described in this study were based on the REAIM framework. So the outcome measures, are they clearly linked to the proposed study aim? You know, just like any other scientific research. Is the unit of analysis appropriate for the study? So the point is that much as it's an implementation project, it must still be scientific in the measurement and analysis. And then the other question is about the policy and the funding environment. In the proposal, is this considered the internal and external policy trends and funding environments, it's clearly described. And of course, this will tie into the maintenance later. Does the dissemination plan for study findings indicate how contribution will be made to the broader policy level? And I think yes, they planned to make presentations to policymakers. So, in a nutshell, this was a relatively well conceptualized implementation project for scaling up PrEP. Those stakeholder engagement was sort of minimal and probably involving the users, the potential users, in the conceptualization of the study would have been beneficial. So that's a brief overview. Thank you for listening.